Hey guys, welcome back to my YouTube channel. I'm Anirudh and today's video is about the fungal infection Mucormycosis, or also known as black fungus. As you all might be aware, the cases of this disease have rapidly increased in India, and this is because of the COVID-19 disease indirectly. Black fungus has also been declared as an epidemic by the government of India. Now, let's get right into this video to understand more about this disease. Mucormycosis. This video we will get to know about mucormycosis or black fungus, its symptoms, recommendations, prevention and treatment of the disease. Introduction. Mucormycosis is a serious but rare fungal infection caused by a group of molds called Mucormycetes. These fungi live throughout the environment, particularly in soil and in decaying organic matter such as leaves, compost piles or rotten wood. People get mucormycosis by coming in contact with the fungal spores in the environment. For example, the lung or sinus forms of the infection can occur after someone breathes in the spores. There are many types of mucormycosis like rhinocerebral, pulmonary, gastrointestinal, etc. But the one that is now prevalent in India is the invasive rhinocerebral mucormycosis, which affects the ear, nose, throat and mouth, and in severe conditions the brain. The common name black fungus is in reference to the blackening that is the characteristic of the disease. Symptoms of rhinocerebral mucormycosis include one-sided facial swelling, headache, nasal or sinus congestion, black lesions on nasal bridge or upper inside of the mouth that quickly become more severe, and fever. How is it diagnosed? Healthcare providers who suspect that you might have mucormycosis in your lungs or sinuses collect a sample of fluid from your respiratory system to send to a laboratory. You may also need some imaging tests such as a CT scan. Your healthcare provider may perform a tissue biopsy in which a small sample of affected tissue is analyzed in a laboratory. What are the causes of mucormycosis? Mucormycosis is a very rare disease, but it's more common among people who have health problems or take medicines that lower the body's ability to fight germs and sickness, that is, the body's immunity. The people who are at high risk of developing mucormycosis include the ones with diabetes, cancer, severe injuries, or hemochromatosis, that is, having too much iron in the body. Lastly, the people who are infected or recently recovered from COVID-19 are also at the risk of developing this fungal infection. What are the causes for a spike in cases recently? COVID-19 patients with moderate to serious symptoms are given steroids and immunosuppressants. This compromises their body's ability to fight off other diseases. This makes them vulnerable to diseases like mucormycosis. Even many recovered patients have a compromised immune system, which makes them susceptible to these diseases. What are the preventive measures that one must take to avoid mucormycosis? First of all, protect yourself from the environment. Try to avoid areas with a lot of dust like excavation sites. Avoid activities that involve close contact to soil or dust, such as yard work or gardening. It's difficult to avoid breathing in fungal spores because the fungi that cause mucormycosis are common in the environment. Hence, avoiding contact with soil or dust which contain the spores is the best option. The second preventive measure is taking antifungal medication. If you are at high risk for developing mucormycosis, your healthcare provider may prescribe medication to prevent it. There is no vaccine to prevent mucormycosis, hence avoiding it is the better option. What is the treatment for mucormycosis? Mucormycosis can be treated with prescription antifungal medicine, usually amphotericin B, posaconazole or isavuconazole. These medicines are given through a vein or by mouth. Often mucormycosis requires surgery to cut away the infected tissue. Now, let's discuss some frequently asked questions about mucormycosis. Where are the spores of mucormycosis found? Everywhere in the environment, especially in decaying materials and in soil. Every one of us come into contact with these fungi or its spores on a daily basis. When does it cause trouble to us? When our immune system becomes impaired or dysfunctional, these fungal spores can invade our body and cause trouble. What helps the growth of mucormycosis in our body? Increased glucose, that is uncontrolled diabetes, increased acidity in the blood, that is diabetic ketoacidosis, and increased availability of iron in the tissues helps the growth of mucormycosis in our body. Is this infection common? No. Till the COVID-19 pandemic started, the incidence of mucormycosis disease was around 0.1 to 2% in very high risk patients. the chance that a normal person will have the mucormycosis infection was almost near to zero. Steroids and higher antibiotics were also used in other patients with other more common diseases, but there we didn't see mucormycosis so commonly. This actually is a very interesting question, and till date we do not have an exact answer. Severe COVID-19 patients are put on a high flow oxygen. Now, when oxygen is gushing along the nostrils with high speed, it erodes the protective lining of nose, exposing the inner tissues to the environment. The mucor easily lodges on these broken surfaces. Now, almost all severe COVID-19 patients have an upregulation of an iron protein called ferritin, which acts as a nice fodder to this fungus. Couple it with immunosuppression by steroids and increased sugar, the fungus has feast for itself. It just grows, erodes blood pipes, and spreads to brain, eyes, and other organs. Hence, our only guaranteed way to prevent this fungal infection is to prevent ourselves from getting COVID-19. And the best way and safest way to do that is vaccination against COVID-19. Thank you very much guys for watching this video. Please like this video, comment down below, and subscribe to my channel. Also share this video to more and more people so that they are aware of such crucial information. Bye.